Welcome back to continue our discussion talking about long-acting reversible contraceptives. Joining me again is Dr. Kelly Humphreys in adult medicine here at Morton Comprehensive Health Services. Let's jump in, doctor, because you were talking about the first IUD that is copper-based and some of the ways in which insertion occurs and testing so that you don't spread infection and all of those kinds of things. I do want to bring you back to one quick question, though, in terms of perforation or nicking of the vaginal areas you're inserting. Is that a risk, or that really isn't a risk?
It is a risk. Perforation of the uterus is what we're mostly concerned about. It has happened in a very few cases, and that is when you go to insert it, you actually go through the lining of the uterus and you can perforate it. Most times, if this happens, the doctor will be aware of it, and precautions can be taken. There have been a very, very few number of IUDs which, because of perforation, probably have slipped through the uterus and into the abdomen and had been into the pelvis, and they've had to be retrieved, sometimes through a very small surgical procedure. That is very rare.
Very rare. Now let me ask this question, because some people may say, well, you know, I tend to be the rare exception to every rule. So if this were to occur, what is the woman going to, the female going to experience? How quickly will this be known?
Well, unfortunately, most times when it does occur, no one is aware. The patient usually does not feel anything, and it's the physician, a well-trained physician, will have a good idea that perhaps it's a problem. Monitoring set up, you can do an ultrasound to check for placement, and you can follow it that way. And most times there isn't really any extra steps that need to be taken.
Okay, now with these devices, any of them, part of this initiative or just in general, does the female come in for periodic checks? Exactly how do you monitor that everything is okay?
That's a good question. In the United States, although not in IUDs all over the world, there is a very small thread at the end of both IUDs.
Okay.
After the 2 weeks that I don't want the patient to have anything in their vagina, no tampons, douching, intercourse, because of the little bit of higher risk of infection, I tell them they can insert a finger into the vagina and check for the string.
Okay.
It takes a little bit of practice to find it. I've had some women who I've inserted one in who have called me and said, I can't find it. They come in, I check them, it's there. They just, it takes a little bit of training and practice before they find it. And that's a good thing, really, because these are usually, there's no problem during intercourse. They're not detectable.
Okay.
You want that to be the case. So they can do that. For the Implanon, and that's the one that fits in the upper arm. It's a one very small cylinder. It's good for 3 years. With the Implanon, when I insert it, I actually have the patient palpate it. Although you cannot see it under the skin, if you roll the skin right on top of it, you can feel the Implanon there. And so they can check it anytime they want to make sure it's in place.
Okay, now we're going to come back to that in terms of what it does and sort of ease of that. Let's switch to this other IUD.
Okay.
Tell me a little bit about that, because that one doesn't appear to have any copper on it, but what does it contain?
If you look, it has a very small cylinder. That small cylinder has a medication in it that is very much the same as in birth control pills as far as the progesterone component. However, it has no estrogen, and that's very important because certain women are at higher risk for of having side effects from birth control pills and any product that has estrogen in it. Maybe because they smoke, maybe because of their family history of blood clots. Well, the good news is none of these products have any estrogen. The two products that have a hormone both just have progestin in it, in them. Why the Mirena is important is because if your patient has heavy, painful periods, the FDA has now approved it to help with that problem.
Oh, okay. The
hormone is slowly released just in the uterus. It actually makes the lining of the uterus very, very thin, so that if the woman has a period, it will be much lighter and much less painful if she has a history of cramping.
Okay, now with this then, since there's a hormone in there, does this have to be replaced more frequently? Does the hormone kind of wane and get weaker?
Yes. In this country, the Mirena has been approved for 5 years, whereas we said earlier the Paragard is good for 10 years.
Right, okay.
But still, even with the hormone component, it is readily reversible. And what we find is within 6 weeks, patients with the Mirena, their fertility returns to baseline and they are able to conceive the same as anyone their age would be.
Okay, well, we're going to switch to our last one here in a moment in terms of the arm insertion, but I do want to remind viewers too that any of these methods are not protection against sexually transmitted diseases.
No.
Nor should they be used in general just as it's for family planning is what we're trying to look at. Family planning issues, so when the female is at the age and hopefully in a marital situation looking at family planning, these are the kinds of things that can be most helpful.
We know that both the mother's health and the baby's health is better if the mother is able to plan the pregnancy and space her children. And so this is a prime goal of the George Kaiser project, is to allow women to do both of those things.
Okay, well, our last minute or so, let's look back again at the arm insertion. You say that goes in the arm. It's something that you can feel and roll to know that it's there. What are some of the pros and cons of this method?
This one is only good for 3 years.
Okay.
Again, one of the pros is it's very easily reversible. It's easy to remove. Some of the viewers may remember the Norplant product, which was on the market. It was taken off the market around 1999-2000. It had 6 different cylinders and was much more difficult to put in place. It was also more difficult to remove, and it had more side effects. Implanon has not been associated with weight gain, which the Norplant was, and it is made out of an entirely different material, so when it's time to remove it, it's very easy to remove.
Now, does this have a hormone component in it as well?
The same one that is in Mirena, yes.
Okay, but why is it only a three-year life compared to even the other has a 5-year that has the hormone?
Well, it has to do with the amount that is there, and again, this product is nice for someone who has a history of pelvic inflammatory disease or sexually transmitted diseases. No testing has to be done to place this product. Also, some women, some young girls may want contraception for reasons, other reasons, just the birth control. This is nice even before a patient is sexually active. There's no testing that needs to be done, no pap smears that need to be done, no cultures. It can be placed really within about 5 minutes in the office.
Okay.
The patient goes away with a Band-Aid.
Sounds good.
It feels like a bee sting to have it placed in your arm, and most patients, when I say, well, we're done, are quite surprised that the procedure's over.
Okay. Thank you so much for joining me, Dr. Humphreys, and explaining and clarifying these new products. And once again, family planning is our focus, and excellent aids. Thank you so much.
You're welcome. Thanks for having me.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150, or if you're on the email trail, please email me at healthalertusa@gmail.com. And also, don't forget to visit me on YouTube at youtube.com/healthalertusa. Take care, talk with your doctor, contact the number that you're going to see right after the show for the initiative so that you can actually begin to engage in family planning with your family and with your doctor. Take care. This program would not be possible without the support of OU Physicians in Tulsa.